Hey guys, good evening. Do me a favor and let me know where you are watching from. Check in and let me know what city and state you are watching from as you come into the room. Let me know where you are watching from. I'll shout some of you out. And then also confirm with me that you can hear me. So as you guys come in, just let me know in the comments that you can hear me. I'm using a different computer today, so I just want to make sure the sound, the audio, and everything is working. So let me know as you come in. I see you guys coming in. Just let me know in the comments that you can hear. Okay, perfect. Perfect. Wasted. So I don't even want to mispronounce that. But come on in. Let me know where you're watching from. Let me know if you have any questions, guys. I'm just going to do a quick Q&A today. Just to let you guys know, let me go to the screen over here. Someone asked, I went live yesterday and someone asked me when my next study session will be. So I went on ahead and scheduled it. It's going to be on Saturday, May 2nd. So that link is in the description. And let me actually go ahead and put that in the chat as well. Let me type it in the chat as well. So for anybody that is preparing for certification, or maybe you are in school and you just need some extra help, I will leave that below. I think I already have it. Let me see. Let me just type it in the chat and then so you guys can see it. But it's just simply bookwithmissk.com, and then just click on the virtual group study session. All right, let's see. Let's see, you guys. Let's see. Um, Kentucky. Hey, Tika. Kentucky. I took my test a month ago and was 1 point off. Wow. Okay, so I know it sucks because you were so close. The good thing is that you know the information. So I will say that anytime somebody tells me, I was so close, I was only a couple points off, 1 point off, that means you know the information. So that means, and this is for Razy, Golden, and anybody else who is trying to take the test again, because you got so close the first time, but you were just maybe a couple points off. Just make sure you look at your detailed score report so you can see exactly where you fell short. Okay, so that's all you need to do is look at that detailed score report so you can see the areas where you fell short so you can restudy those areas, double down on studying those areas so you can be ready next time. Okay. We got Louisiana, Texas. Hey, Texas in the building. Um, on my way to class. Okay, I'm glad you were able to check in on your way to class. Is that Sabali? Wasted says Fayetteville, North Carolina. Just left my Army graduate. Oh, congratulations! Oh, let me put that on the screen. You were salutatorian. That is so awesome. Congratulations. Congratulations and good luck to everybody that's about to take your test. I see you said you're going to be taking your test on May 1st. So good luck with that. Congratulations, Dominic. Dominic says you helped me pass my test. Let me put that on the screen. You helped me pass my test back in 2024. Never found a job that wants you to have a few. Yeah. I did address that yesterday. I went live yesterday, Dominique, and I did address that. And this is for everybody who happens to be looking for a job right now. Maybe you're having a hard time. I did address that yesterday, and it's unfortunate because some jobs they do want you to have experience, but it's like, how do I get the experience? If nobody taking a chance. So I definitely recommend looking for some recruiting agencies in your area. Recruiting agencies, staff agencies. All you guys have to do is look up, what is. I said what is. But look up MA recruiting agencies or staffing agencies or just healthcare agencies in general. They tend to do, MAs, nurses, and all of that. And then also, of course, going around to private areas, to private offices in your area with copies of your resume, and passing those out to see if they're hiring. Good to have you back too, Betty. Let me see. Sabali says I must do externship first, then I'll be able to take my exams. Does externship count as experience? Externship definitely counts as experience. That's a really good question. It absolutely does. Thank you for asking this. StreamYard, make sure you clip that. That is an excellent question. So externship does count as experience, and this is why I always have my students to add externship to their resume. So even though it's just 1 month, and thank you for liking the video, guys. Do me a favor if you haven't already, make sure you like the video, and subscribe if you haven't already. For those of you on YouTube, um, definitely count it as experience and add it as a job, even though it's only a 1 month job. So let's just say you do externship from May 1st to May 31st. Guess what? It counts. So you add that, and then you can also add a note that it was externship. So you know where you put your title, medical assistant, under your experience. You can just put externship in parentheses, and every single thing that you did on externship, you added to your resume. Everybody should be adding their skills to their resume anyway. Everything that you learn in school, you add. Every single thing you do on externship, you add. When you start your job, every single thing that you learn, you add to your resume as experience, as your clinical skills. So yeah, thank you for asking that. That is a excellent question. And I'm going to use this as a clip, so anybody else who has the same question, they'll know. And as far as whether you have to do it first before the exam, it depends on your school. So some schools, specifically schools that offer the RMA exam requires that you do 160 hours of externship. Um, and if that's the case, they may require you to do your exam before, I'm sorry, they may require you to do your externship before the exam. So it just kind of depends. But for the most part, no, it doesn't matter which one comes first. It depends on the school, and then it also depends on the test you're taking, because the RMA, they do require 160 hours. And even then, um I'll use my former school for an example. We offer the RMA. So our students, some of them, they did take the exam before going on externship, and we would award that student, they would automatically get a 100% on their final exam. So if they went and took the test and they passed, they automatically got 100% for their final, and then they went on externship. But because the RMA requires that 160 hours of externship, even though they passed the test, they would not be official until they completed externship. So the RMA organization, what is that, AMT, they would not give the certificate until they finish externship. So although they allowed students to take the test first, it wasn't official until they finished those externship hours, and then they could get their RMA certificate. So hopefully that makes sense. So it just kind of depends on the school, and then it depends on the certification you're taking. So if you're taking like the CCMA, no, they don't require externship. I can't remember CMA, AMA. I think they require externship as well. Don't quote me on that, but you can quote me on RMA, because I do know for sure they do require it, and CCMA does not. CMA, AMA, I need to look at that again. I can't remember. I think they do, but I can't remember. You're welcome. How long should externship be? It depends. So for the RMA, they require 160 hours. There's no way around that. Any other certification or any other school, it just kind of depends. For some schools, externship is a part of their curriculum, and you cannot be official until you do externship. So again, back to one of my other former schools, externship was a month long, and actually it was 140 hours. And so it just kind of depended on how long it took that student to do it, depending on they were only doing 4 hours a day or 8 hours a day. So it just kind of depends. But they had to complete externship to be an official medical assistant. With some programs, you finish the program and you are a medical assistant, and then you go to externship. So it just kind of depends. And then some schools, they don't have externship at all. Some, it may be 2 weeks. Some may be just a certain amount of hours, 100 hours, and it depends on how long it takes. So it just varies. So if you're taking an RMA, absolutely has to be 160 hours. Any other certification, it just kind of depends on the school. Y'all are asking some good questions. Thank you. I'm definitely going to clip that as well, because that was a good question as well. And the software I use, it's pretty good with making clips from some of these questions anyway, and I usually turn those into shorts. And so I definitely want that as a short as well. So hopefully it clipped it. Chuck says, let me see. Chuck says, should you go into an interview dressed nice, casual, business, or scrubs? Great question. I get this a lot, Chuck. And a lot of people will tell you to just go ahead and go in scrubs. I recommend to dress business to be on the safe side. Now, if they tell you to come in scrubs, perfect, go in scrubs. But if you are ever unsure, to be on the safe side, and this is with any job, whether medical assistant, phlebotomist, even outside of healthcare, always be on the safe side and dress business. Even business casual, like you may have a button up, you may not necessarily have on a blazer or a suit, but at least a nice button up and some slacks, right? Because you can always just be on the safe side. Um, for me, my former position, I was a part of the interviewing process, and we would tell our interviewees to come in scrubs because we knew that we were going to do a working interview. So if you know you're going to have a working interview, you may want to, ask, should I come in scrubs? A lot of places they don't mind, but then some places do. Yesterday I was live and I talked about this and I shared how a young lady in my Facebook group, she shared that she arrived to her interview in scrubs and the manager was like, what made you think that was okay? So this is why I always say be on the safe side. But you will hear a lot of people say they went and it was no problem. You'll hear a lot of managers say it's no problem, come in your scrubs, but then of course, like I said, there are those situations where it's not okay. So if you're ever unsure, be on the safe side. Um, the rule has always been to be professional. So you always just want to be professional and then you can always take your scrubs with you. Um, Hello, I'm from California. Take my exam. Okay, good luck with that, Yvonne, and everybody else that's preparing to take their test. Um, if you're going for administrative position, you must dress business and make scrubs is acceptable. That's what I was told. So yeah, you're always going to hear different things, Chuck. And for anybody else that's wondering, some people it's okay. Even if you ask, like I said, a hiring manager, they'll tell you it's okay with them. But then some hiring managers, I've had hiring managers chime in to say, don't wear scrubs. So it just kind of depends. Miss K, I have my exam. Okay, so another person taking their exam, Crystal. Shout out to Crystal. Good luck to you too. Another question. Can you tell me the difference between CCMA and CMA? So I do have a video on this. So for those of you that um are watching me on YouTube, I do have a video where I break down the differences between all of them. But in short, exotic bombshell, the difference is well, few differences. The biggest difference is the organization, so the certifying body. CCMA is through NHA, and then the CMA that is through the certified by the AAMA, the American Association of Medical Assistants. And the CMA is a 5-year certification. And this is a certification that is considered the golden standard, right? This is a certification. It is a little bit more difficult to get because you do have to graduate from an accredited school. So you can't just be anybody going to take the CMA AMA. It has to be an accredited school through ABPAS, and then the other one I always forget, the CAA HEP. You have to be accredited. It's a 5-year certification. Um, and the CCMA, it's a 2-year certification. It's easier to get. If you've been out of school for a while, but you've been working as an MA, it's very easy to get the CCMA. And then you have the RMA, which is given by the AMT. So check out that video. But the biggest things, like I mentioned, the amount of years the certification lasts for, what they require, the CMA, AMA, you have to graduate from an accredited school. And if you graduated from a school that accepts the CCMA, it's not that your school is not accredited. Some schools may offer, some schools don't. And then also with the CMAA, AMA, like I mentioned, you had to go to an accredited school. So that means you didn't go to a school that was just a 12-week school online, right? So it's just different requirements that they have. But yes, the CMAA, AMA is considered the golden standard of these certifications. And then you're automatically a member of the AAMA, which is the American Association of Medical Assistants. And you can join the AAMA if you're not certified through them, but you are automatically a member when you get certified through them. And I do have a video, like I mentioned, I may do an updated one soon to include some other certifications like the NCCT and the others. But I do want to tell you guys that some jobs, they don't care as long as you're certified. So some you will see some listings that do prefer one over the other, but for the most part, employers just want you to be certified. I will tell you guys that. And then again, a CCMA, I usually recommend for people who have been out of school for a while. They never got certified, but they've been working, or they have been working as an MA, but they never went to school. So they will accept you if you've never went to school, but you've been working in an MA capacity. Okay. And then just to remind you guys, my MA refresher course, I linked that with along with these videos. If you're preparing for certification, any certification, my refresher course does help with that. I have it on the screen there. Let me just kind of hit that play button so you can kind of get an idea of what's in it. But I have modules in there where I'm going over different topics, and then there's a quiz after each module, and then there are practice questions as well, over 400 practice questions in there. So if you're somebody that's preparing and you need that extra online study guide, you've been watching my videos, but you like, listen, I need something else, I need more, you can always get my study guide. It is linked below. Matter of fact, let me post it here in the comment section so you guys can get that. Let me scroll down and get it, and then I'll put it in the comment section for you guys who maybe need it. All right, let me go back up to the questions. I want to answer them as I'm getting them. Okay, so good comment. My school has externship as part of the curriculum. The final semester you have externship. Yeah, so every school is different. If you are taking the RMA, as I mentioned, you definitely need externship. Same question. I did just answer this. So, Jennifer, hopefully that answered your question. And also check out the video as well, because I talked about the difference between how many credits you need for each one and all of that. But the biggest thing, as I mentioned, is the amount of years, of course, and the requirements, and then the certifying bodies. Certified CMA, that's what I want to do, CCMA. So a CNA of 13 years, what do you think would be the best for me? So the CCMA. So if you go to nhanow.com, you can go and look at the eligibility. I believe you would qualify to take the CCMA. You have to look, even though CNA, I do want to mention though that CNA and so nursing assistants and medical assistants are two different things. I did a video on that on TikTok, and I broke down the differences between the CNA. And guys, I'm on TikTok, Medical Assistant with Miss K, if you guys want to follow me there. I already had a TikTok, but I started a separate one just for medical assistant. Same name. But I did a video breaking down the differences because people use them interchangeably, but CNAs is they are licensed. Okay, so when you're a CNA, you're licensed in the state you're working in, and you work alongside the nurse in nursing homes or the hospital, a lot of patient care. Whereas medical assistants, we are in the doctor's office assisting a provider. Some of the same things we do includes like vital signs and things like that, but two different professions. So I will go to the website, see if you're eligible, and then also you may do well with my MA refresher course, because some of the things you did not learn when you went to school for CMA for CNA that you need to know as a medical assistant, you'll learn in my refresher course. So my refresher course is also for people like yourself, Exotic. All righty. You guys are welcome. I don't see any other questions coming up right now. So if you guys do have a question, I'll give it a few seconds and give you guys a chance to put it in the comment section. If I don't see any other questions coming up, I'm going to end this, but I just wanted to come on. I was on here yesterday. I answered a question. And someone asked if I'm going to be live today. And I said, you know what, maybe I will. So I just wanted to come on here. You're welcome, Exotic. Oh, she said, can somebody drop the website again? Yes, I'll put it here again. Yeah. So you can really benefit from my MA refresher course. Um, and then also, guys, so the other thing you see on the screen is Beyond the Clinic. That is an ebook that I came up with. So you guys know, outside of being a medical assistant and medical assistant instructor, I have a CPR first aid business, and I have a couple other businesses that's outside of the clinical stuff. And so that ebook is for anybody who wants to do the same. I made a lot of money in 2025 with my business. And so I just like to help people do the same. And so that's what that ebook does. Like, I just break down just how to figure out what kind of business you want to start, how to actually start a business and create an LLC and all of that stuff. So I'm linking that in the chat as well. It's already in the description, but I'm linking that in the chat as well. Oh, the website for the CCMA, that's nhanow.com. So www, let me type that here as well. www.nhanow.com exotic. I put that in the chat for you. Jeanette says, what's the best way to memorize the tubes? So the best way is to create I always say acronym, but it's actually a mnemonic. So my students came up with young boys really get great looking girls. And somebody can put that in the chat. Young boys. Matter of fact, I'll put that in the chat. Young. And you can create your own, but young is for yellow. So young boys, yellow, which is blood culture. Okay. Young boys. And the B is for light blue. Light blue. And I'm typing this as I'm saying it. That's why I'm talking so slow, guys. So young boys, really, which is red. Get, which is gold, SST. And remember, gold is SST, okay? And it's also marble as well. So you may see marble. Really get great looking. So great is for green, okay? Looking, and that's for lavender. Girls, and that's for gray. Okay, so yellow, light blue, red, gold or SST, green, lavender, and then gray. Okay. So I'm putting this in the chat. So if you can copy and paste it, Jeanette, you can do that and keep that. And then you can also make them your own. I've seen so many different ones. You guys can feel free to share yours in the comments as well. And do me a favor, I see there's multiple people watching. Just everybody just quickly let me know in the chat what your status is. So are you a student? I know some of you guys, if you already did, you don't have to again, but I know a few of you guys said you're in school about to take your test. But for those of you who haven't already, just let me know what your status is in the chat. Are you in school? Are you testing? Are you already an MA? Have you been an MA for a while? If you have, let me know how many years as well. So just do me a favor. Let me know who's watching. Mispa said, could you please have one-on-one? So I don't do a lot of one-on-ones anymore, but if you go to bookwithmissk.com, you can do a 15-minute phone call. That's the most I do. I don't have the capacity to do one-on-one sessions like I used to, but I do have a group session coming up on May 2nd. So you can go to bookwithmissk.com and then you can schedule that. So bookwithmissk.com. I'll leave that here. And then just click on virtual group study session. And that's going to be on May 2nd at 11 a.m. Eastern Standard. And it's on Zoom. And for those of you that join, you got to have your camera on because it's a private setting. And just to protect the integrity of the meeting, we all have our cameras on. My TikTok is just medical assistant with Miss K. It's the same as my YouTube and my Facebook name. So, Jeanette, if you haven't already, you can copy and paste that comment there. Hopefully that was helpful. Graduating this week, about to take your test. Congratulations, Cheyenne, and good luck on your test. Contemplating on sterilization tech or CCMA. Okay, so yeah, so you're a CNA, so you're trying to think about which two. I mean, if you do CCMA, all you have to do is just a matter of studying for the test, to be honest, right now, Exotic. So because if you do sterilization tech, that's more school. So you can always do CCMA for right now, work as an MA because you already have, the experience. So if you, you know, study and take the CCMA and you pass, work as an MA, and then maybe while you're in school to become a sterilization tech. So that's just an idea. Jeanette want to do phlebotomy and EKG certification. Yes, stack those credentials. Yeah. So you've been an MA for 2 years. And for anybody that's wondering if you should, I definitely recommend stocking your credentials. If you're already a certified MA, yes, EKG, phlebotomy, as much as you can, stock your credentials. I recommend that for everybody who plans on working. Now, some of you guys, you may not want to do that because some of you are just going from MA straight to nursing or MA straight to like sterilization tech, for an example, like Exotic just mentioned. So if that's you, then you may not want to stack your credentials. But if you want to work as an MA for a while and you want to try to, get more money and be able to work in different capacities and all of that, definitely stack your credentials. I CCMA been on for 2 years. Prior to that, I was a PCT. Oh, for two. Oh, wow. So you got a lot of experience, Sarah. Also have my interpreter degree. Listen, I'm so glad you mentioned this. Stream, y'all, clip that. So Sarah mentioned that she has her interpreter degree. Sarah, do you know? So I, at my former school, I got a lot of students who were bilingual, and I told them, I said, listen, you guys need to get certified as an interpreter because now I didn't know they had an interpreter degree, but I know they have interpreter certifications. So that's awesome that you have a degree as an interpreter. But I tell my students, if you are bilingual, if you speak multiple languages, you need to get certified as an interpreter because I'll use my company for an example. The company I work for, you can't just translate for a patient just because you work there. You have to be certified as an interpreter because you have to make sure you can translate medical terminology, and all of that. So I recommend getting that certification so you can work as an interpreter and as a medical assistant, right? You can do both. You can even I know I have a friend who has a sister who is actually certified as an interpreter, and she actually like has a business. So they call her, she goes to different doctors' offices and like she's like contracted, so they'll call her to interpret for different patients. One day she might be in cardiology, another time she might be in GYN. So thank you for mentioning that, Sarah. So for those of you that are bilingual and you're in the medical field, I definitely recommend looking into getting certified as an interpreter. At my company, they actually offer classes for people that work there for bilingual employees. They offer the certification within the company. So I definitely recommend that. So thank you for mentioning that, Sarah. Is it Sarah or I'm sorry if I'm saying your name wrong because I do see that there's other letters there. So I'm sorry if I'm saying it wrong. Working on, oh, that's awesome. You working on your master's in public health. I love that. I love it. I love it. Thank you for sharing that. I'm glad you found it as well, Exotic. I'm glad, and I'm glad you're here, and hopefully this information that you got here today was helpful. So guys, I'm not going to stay on here too long. I just want to remind you, Saturday, May 2nd is going to be the next group study session. And so, I wanted to let you guys know that I did put the link there. Also wanted to remind you guys about my MA refresher course, all of the things that I have going on. Let me give you guys a couple more seconds, see if any other questions come up. And if not, I am going to end this. I've been on here almost 30 minutes, 28 minutes. And do me a favor, guys, if you're watching on YouTube, make sure you like the video and hype it if you see the option to do that. If you're watching on Facebook and you enjoy it as well, like the video. If you're on YouTube and you're not already subscribed, make sure you do so. If you're on Facebook and not follow me on YouTube, make sure you go to YouTube and follow me. MA for 20 years. Awesome. Taking a CMA in June. Any tips? So yes, so I do have a if you go to my channel and you click on playlist, you'll see more study tips, but I will tell you this, make sure you have the study material if you don't already, and make sure you download the test plan for the test you'll be taking. So you said the CMA, so I'm thinking you're talking about the CMA AAMA. So all you do, you just go to Google and you type in CMA AAMA test plan. You want to download it or print it, and you want to just make sure everything that's on that test plan you can check off or highlight. You want to just make sure you know everything on the test plan, and it's going to look like a lot because it is, but it's not as much as you think it is because a lot of the stuff you're going to already know. So you go on there, check off as much as you check off everything that you know, and everything that you don't know. Guess what? You're going to go back to your study material and you're going to make sure you know that information. Okay. Um, the good thing is that you've been an MA for 20 years, so you have that experience, but I'm pretty sure you forgot a lot of the bookwork stuff. So also my MA refresher course, you can always check that out. I have that link in the chat. I'll link it again here for anybody that maybe just joined. But I literally created it for people like you and mine who have been in the field for a long time, and you need a refresher. So again, check out that playlist as well, and download that test plan. Oh, you're working on a certification for, oh, that's awesome, Sarah. When studying for the NHA, should I study the material? Is there a certain order? So this is a really good question. What order should I study? And StreamYard clip that. And when you guys hear me say clip that, I'm just speaking to the software that I use. They have this feature now where um anytime I get something that I wanted to make a automatic clip out of, it just tells me to say clip that. So if you hear me say that, I'm just asking it to clip it so I can make it into a YouTube short, or a Facebook reel. So for people that want to know the order that you should study in, so this always depends. I always say it depends on when you are taking your test. Okay. If you have some time, like for an example, for somebody who has a few months before they're going to be taking their test, I just say study in order. So when you're on, if you have the NHA study guide on the website, just start at module 1 and just go through each one. There's quizzes within each module. You just go through. And also, as you're going through, again, this takes me back to the test plan. As you're going through each module, you're checking off the information on the test plan, okay? And or highlighting, however you do it, everything that you know, everything that you learn, you check it off on the test plan. So you go through module 1, go in order. There's 13 altogether if you're taking a CCMA, or if you have my MA refresher course, same thing. Because I do have a 3-month access and a 6-month access. So if you have time, you get the 3-month access. You just start at module 1. You go through it in order. Now, if you're someone who is like, listen, I'm about to take my test within a month, or within a couple of weeks, usually for that type of situation, I usually recommend to go in the order that you struggle with the most. So if you're about to take your test very soon and you struggle with phlebotomy, I would suggest going to that module first. That's the order you would go in if you are on crunch time. Start with the areas where you struggle with, okay? And then also, again, it brings me back to the test plan. That's the number one thing I recommend you guys to download. As you're going through, again, you're going to be checking off everything on the test plan, because the test plan lays out everything you need to know. So if you're checking out those things off, you're just making sure you know what's going to be on the test. So it doesn't matter which question they ask, you know all of the content anyway. So hopefully that helps. So Cheyenne, that was a good question. Thank you for asking that. So if you have a lot of time, you just go in order. If you're on crunch time, you're taking your test within a couple weeks, or even if you have a month, you can go in order. But if you're on crunch time, taking it within a few days or a few weeks, you want to start in the order in which you struggle with the most. Amber says I'll be starting my clinical on Mondays. Okay, clinical. So when you say your clinicals, Amber, because I'm noticing that more people are using this interchangeably. Are you saying you're starting your externship or your actual clinical, your hands-on learning at school? So let me know, because I've noticed that some people call externship clinicals. So I'm just curious to see if you're speaking on your clinical portion of school or your externship. Neurology care, what should I expect? So I've never worked in neurology, but I know you'll be assisting with vital signs. You're going to be assisting with taking doing assessments. So in neurology, they do these tests. They do assessments on paper where they have to. I forgot. I don't. I'm not even going to try to name the assessment that they do, because I forgot what it's called. But you may be doing those where patients, they get a questionnaire, and you may be responsible for assisting with those, and then also electroencephalograms. There's another procedure that they do where they may take spinal fluid. So there's different type of procedures they do in neurology that you may have to assist with. But I've never worked in neurology, but I have a little bit of just a little bit of knowledge just from teaching, but I've never actually worked in neurology. So I would definitely look up some videos on what types of things that medical assistants do in neurology. Excuse the background, guys. You guys, I live near a train track now, so you probably hear the train going by in the background. Hey Ruda. Ruda says first time here. Glad to have you. I'm glad you were able to catch me live. Oh, hands on learning for okay, gotcha. So Amber, gotcha. Okay. So you're just about to do clinicals at school. That's awesome. So if you're in an accelerated course, I recommend looking at some videos before you go in person. So I work with a school that's accelerated. It's only about 13 weeks and they only get a few days hands on. So usually I tell them watch some videos. So like if it's your vital signs day, watch some videos. So that way when you go in there, you already know what to expect. If you're going to be doing phlebotomy, make sure you go in and you make sure you watch some videos before you go in, EKG, whatever, just to kind of already know what to expect. Ruda says I'm a medical assistant, got a job. It's been 2 months after 8 months looking for a job. Oh, it scrolled up. Let me go back. I'm loving it, but I haven't taken the exam yet. I'm kind of scared. Yeah, it's expected to be scared or nervous. Your experience is going to help you. So I would say don't put it off because you don't want to forget the information. So you're still kind of you said after I don't know if you're saying oh it's been 2 months after 8 months looking for okay, gotcha. Okay. 2 months after 8 months looking for a job. Okay, I got you. But whatever the case, I wouldn't put it off too much longer. If you want to get my MA refresher course, that's going to be pretty helpful to you. But I wouldn't put it off, and it's normal to be nervous. Just make sure you're following the tips that I've been giving you guys, and you should be fine. But I definitely wouldn't put it off. Hey, is that Sanji? Hey, Sanji, glad to have you here. Let's see. You guys probably hear my stomach growling too, because I am hungry. I just got off work, and I got off. I work remote now, and I do prior authorizations, and I literally jumped straight on here before I even before I even went to go eat. So you probably hear my stomach growling. So please excuse me. So I'm not going to be on here too much longer because I need to go eat. Miss K, I passed my CCMA exam. Congratulations. Just wanted to say thank you. You're welcome. Genuinely owe my whole sort of, oh, I was so scared, but I watched your videos. Oh, I can't see the rest. I can't see the rest of the message, but you are so welcome, Boots. You are so welcome. And to the person that just said they were scared, I think that was Ruda. Just watch my videos. They're going to help you a lot. Also my MA refresher course. I'm telling you, you definitely can do this. I just wouldn't put it off. Congratulations. Oh, okay. Odalis. I hope I'm saying it right. I hope I'm saying it right, Odalis. Still studying. Gotcha. Yeah, so that's good. Still studying. Still studying. Sanji says, I'll take my test for the second time the end of May. Good luck with that. The CMA, good luck with that, Sanji. Make sure, since you're taking it again, just make sure you are, make sure you look at your detailed score report if you haven't already, so you know what areas you fell short in. So the detailed score report, it shows you what areas you scored above the average, and then below average, above the national average, and then below and then below average. And then also it'll tell you where you scored. It may say near the passing standard. So you can kind of see where you fell short. So make sure you look at that so you know exactly which areas you need to be double down, or that you need to double down on. They don't do injections at the office I work. Oh, you sound disappointed. I get it, because I get it, because you want to use your skills that you learned in school. I get it. So get your experience. And so this is for anybody. Get your experience. So I get it, because I do have students that end up getting hired at places where they're not using all their skills. I always say get the experience and then just apply to other positions. You know what I mean? It's better, it's easier to get a job when you have a job. And so just work the job until you find, do what you got to do until you can do what you want to do. So if you want to work somewhere where you can do injections, just continue that job and then apply to other places where they do injections. Because I get it. I want to use my skills. I don't want to work somewhere where I'm not, drawing blood and doing, injections and EKGs and all of that. Like, I need to be doing something. Like, I cannot work somewhere where I'm just answering phones, or, well, now I'm doing this, but you know what I mean? When I was in person, I need to be able to use my skills. So I get it. Megan, glad to have you here. Thank you. I'm glad the videos are helpful. And you are welcome, Sanji. All right, guys. So it's been 41 minutes. I don't see any other questions coming up. Just one more time, I just want to remind you, for anybody who needs a study session, the next one is going to be on May 2nd, 11 a.m. Eastern Standard. You can sign up at bookwithmissk.com. The link is also in the description of this video, also in my refresher course, and in my ebook for anybody that wants to make money outside of the clinic. Okay, guys? So I think that's it. If you haven't already, make sure you like the video. If you're on YouTube and you're not subscribed, make sure you hit that button. Hype the video as well. Facebook, you guys like the video too. I appreciate that. That's what helps me out. So when you guys ask me, what can you do for me? What you can do for me is liking the video and sharing the video and subscribing. All right, guys. Y'all have a good evening.